Andrew Cuomo is in the news again after a aide claims that he sexually harassed her. We look at this story as well as how it plays into Cuomogate. We're doing a deep dive into the Andrew Cuomo nursing home scandal. This is your February 26th Not So news. Let's dive on in. Starting us off from CBS News, we have a former top aide details sexual harassment allegations against New York Governor Andrew Cuomo. Lindsay Bohan, who's the former chief of staff at the New York State Economic Agency, claimed that the governor took an uncomfortable interest in her after she was appointed to the role in 2015. My boss soon informed me that the governor had a crush on me, he wrote. This comes out after multiple stories of her being harassed. One of these includes him apparently asking her to play strip poker, as well as other aides coming out saying that the governor just didn't provide an environment that was beneficial to just a good general workplace. There's multiple other allegations that were made. However, the only one that was related to sexual assault did come from Lindsay Bohan. A lot of government officials are coming out in support of Cuomo, saying that this was just normal Andrew Cuomo things. Some aides said that some of the allegations weren't true, but this just adds on to what's going on with Andrew Cuomo getting attacked by just everyone now. After getting his Emmy, we had all the nursing home scandals that we're really wanting to do a deep dive in now for what actually happened there. So first, New York Post gave two stories that are related to the nursing home scandal in New York. The first one relates to the number of COVID deaths, and the second one is related to why the number of deaths weren't shared. So this first one came out on January 28th, so about a month ago, that says the New York nursing home COVID deaths were more than 12,000, Cuomo Health chief reveals. The main thing coming here is how there was a disparity between the number of records being reported as nursing home deaths. The main reason why nursing homes were such a scandal within the Cuomo administration is they had an order, like a couple of other states, that the nursing homes were required to take in patients. After doing more analysis, this appears to be a misunderstanding by the nursing homes that they weren't actually required to take them on unless they had some procedures in place for handling COVID. However, with that, they were told they had to take patients regardless of the COVID, if they were diagnosed or not with COVID. However, they were supposed to take precautions in the transportation. So there's a little bit of precise language that needs to be looked there. However, when we're looking at this New York Post story, we're mostly just looking at the numbers of COVID deaths. So the first one is, in the defense nearly 1,700-word statement, Dr. Howard Zucker released figures that put the tally confirmed and presumed deaths in both nursing homes and hospitals at 12,743 as of January 19th. This is for patients that would have gotten the COVID coronavirus within nursing homes. What's interesting about this, however, is earlier Tuesday, the DOH website put that same figure at 8,740. So this is roughly an increase in about 4,000 deaths that are assumed to be related to nursing home spread of coronavirus in the nursing homes. This doesn't necessarily mean all of these would have been prevented by Cuomo's policy. However, it does give us a reference for how much misinformation was being spread, and goes into the further story of why these numbers are so wildly off. So this was also reported by the New York Post that the Cuomo aide, Melissa DeRosa, admits they hid nursing home data so feds wouldn't find out. In the story, they talk about how there was a talk with members of the Democrats, and they kind of tried to give their justification for why the numbers are so far off. So in it, they give her her remarks. He starts tweeting, and this he is referencing to Donald Trump. So Trump starts tweeting, and we killed everyone in nursing homes, DeRosa says. He starts going after New Jersey Governor Phil Murphy, starts going after California Governor Gavin Newsom, starts going after Michigan Governor Gretchen Whitmer. In addition to attacking Cuomo's fellow Democrat governors, DeRosa said Trump directs the Department of Justice to do an investigation onto us. and basically refroze. She told the lawmakers in the call, because we were in a position where we weren't sure if what we were going to give the DOJ or what we give you guys, what we start saying was going to be used against us, while we weren't sure if there was going to be an investigation. That played a very large role in this. Afterwards, she asked for a little bit of appreciation of the context. This shows how much of a disparity there is in what we expect from our elected officials. We do not want appreciation for context. What we want from our government is transparency. Luckily, what we're seeing as a result of this is a lot of Democrats coming against the Cuomo administration for this very reason. That there were individuals that died as a result of this pandemic, and hiding the numbers is the absolute wrong thing to do. Early on in this pandemic, nobody knew how to react. And there would have been a lot of forgiveness if there was transparency and numbers were given and reported as desired. Doing things like asking for appreciation in the context just shows the disparity in how they're getting information out to the public. And this really, in my opinion, shows why there's so much lack of trust for things like the vaccine, and how governments are handling the virus, and how politicized it has become. One of the government officials that has been coming out against Cuomo is New York Assemblyman Ron Kim. Notably, this is one of the Democrats that has been coming out against Cuomo, and he goes into a report that Cuomo got about $1.5 million in campaign donations from the same industry who wrote language about the legal immunity. What kind of happened here, from my interpretation, is that lobbyists from nursing homes and that industry added a part to the budget that went into giving a legal immunity to nursing homes, specifically during the pandemic. This is a completely for-profit industry, and they were given a lot of protections that normally they don't have. He also goes into how there's a lot of issues when it comes to just adding these types of things to spending bills. This might be more into the Guardian's piece, yes. So the Guardian also wrote a piece on this, where he has the following line in the article. Many of my colleagues had no idea the 2020 budget contained a legal shield that gave nursing home executives, trustees, and board members blanket immunity. I voted against the budget bill, but if more members knew about the full impact of the legal immunity clause, there was no chance this would have passed. He then adds the following: these are laws like corporate legal immunity that would never pass as standalone legislation. This gets into a real issue that's going on consistently throughout the history of just trying to get legal legal measures passed. There's recently a bunch of things for trying to get COVID stimulus passed, and they've added things like the minimum wage, which has nothing to do with people receiving COVID relief. There's absolutely every reason that I would expect overwhelmingly support for COVID relief, and there's probably only going to be about 40% support for something like a $15 minimum wage, and I think that's even a bit of an estimate. However, what you see is tying the two together to make it so you have just barely a 50% support for this type of bill. Instead, what would make a lot more sense is passing the part that has overwhelmingly 90% support, vote on the part that only has 40% support, and don't pass something like that. Let's stop playing games with people's lives. Let's stop playing games with people's legislation. As part of being a member of Congress, whether it be in a state body or the federal body, we want people that work with the other side to get things that everyone wants passed. I care a lot less about my party getting their particular measures passed, something that I've been very critical of both Republicans and Democrats, as I've been trying to be this militant centrist, is that stop playing games, pass the things that have overwhelmingly 90 plus support. Bipartisanship is not having 2 or 3 representatives from the other side coming to your side. Bipartisanship should look like having 90+% approval. From a recent NBC News, continuing the story, Governor Cuomo says New York couldn't report nursing home deaths in hospitals, but other states did. Part of this argument that they go into is how part of the problem was that nursing homes and hospitals were reporting to different databases, essentially, for reporting their numbers, which really, in my opinion, shows how inadequate the system was that was set up during this pandemic. They could easily, so early on, there was expectations for a lot of deaths during this pandemic, at which point you would expect there to be some type of database created with an API call that, a nursing home or a hospital would be able to call to report a particular COVID death. Why that was not done is something we should hold our elected officials to. If that type of database is created, it would be a lot easier to get any number related to COVID deaths. And it also deals with the issue that they bring up is that there's a hard time with verifying and avoiding double counting. Assuming there's some type of ID field in this database, so something like a social security and birthday, whatever it requires for you to have a unique identifier for an individual. At that point, you can avoid the double counting issue. You can have a field in there that says where the person died, and you can have a simple query of that database that says the number of COVID deaths from hospitals, nursing homes, etc. Why this was not done and why this became such a polarized issue that they were not able to get simple numbers, day to day is beyond me. The fact that there was a CNN ticker constantly for over a year that said the number of deaths down to the minute, and that data was coming from the states, shows that other states had accountability and technology in line that were able to report these things. The type of technology that's required for this type of counting system should be done by an intro comp sci student. I talked about this on my live stream, that this is something I would expect from a 101 comp sci class for just doing a counter that then when you pass a new object in, you're able to identify if it's part of the list or not. That should be simplistic. However, we look from how Cuomo has responded to all this. Specifically on the COVID scandal, he said that he should have been more aggressive against COVID deaths misinformation, announces nursing home reform initiative. I'm not particularly interested in the nursing home reform, but here's the following line that I want to pay attention to. It is a lie to say any numbers were inaccurate. That is a lie. Total deaths were always reported for nursing homes and hospitals. What we see here is a direct play at semantics here. The total deaths were never in question. What was in question was the particular number of deaths for nursing homes and the particular number of deaths for hospitals. The total number of deaths was never in question. We see a semantics game here that he's saying that because they gave the total number of deaths of, I think it was roughly the 12,000 number, that they were in the clear. That is not correct. What you need to have is a breakdown of how many deaths happened in each particular spot so that you can then be clarified if your policy helped or hurt the situation. Even if you hurt the situation, it is information that we could then use for the future pandemics. We could use for, if something like this happens in a decade or so, or we could use to stop your policy if it was a bad thing. Stopping a bad policy is a good thing, and you should be propped up for that. Something that is a real issue in our current political system is we don't give people a chance to make. Let's be completely honest. The nursing home scandal here, it was probably a mistake. We never hit full capacity in the hospitals as far as I'm aware, and it probably would have been a better idea to keep COVID patients isolated. However, I'm looking at that in retrospect because I now have the data. If you're not sharing data, people cannot make that decision, and that's where the root issue here is. The issue is not the number of deaths, but the lack of transparency from your administration. And this is your February 26th Not So News update. Please like and subscribe if you enjoyed the video, and have a good one.